So natural treatments, you might be wondering. Most people that come to my practice know that we're all into wellness, health, and natural remedies. There are some natural treatments for neuropathy, and we're developing some as we speak, but natural treatments aren't really going to cure your neuropathy, just like, honestly, Western treatments are. But I think they're a good adjunctive method if you have full-blown diabetes and diabetic neuropathy. And we'll talk about a few of them. I'm going to talk about one right now. But I think they should be part of your program, because if you are on a good natural or complementary health program, you can actually see a reduction in the synthetic medications you take and a reduction in surgeries and things like that. So lifestyle change is probably the most important, and this is difficult for people, and we'll help you. It's baby steps, in my opinion. You don't have to be Madonna or J-Lo with a personal chef and working out 7 times a day and having oxygen treatments and going into a hyperbaric chamber and all of this fancy stuff. None of us can do that, but just little tiny things like I tell patients start with, don't eat processed white bread. Quit buying Wonder Bread or Bunny Bread. Start there. Get the organic whole grain bread. Little things. You get used to it, then you add another change. If you drink full test red Cokes, which is a ton of sugar, maybe try to reduce that amount per month, and then next month go down a little bit more. You have to make changes that you'll stick with and that don't stress you out, because stress is another form of inflammation. Nutrition and adjunctive methods, I'm going to talk about some of those. But remember, diabetes is a chronic inflammation problem, so you got to control the inflammation. Lifestyle changes, no fads. So none of this keto, Atkins, 30-day, whatever, all these fancy little fast diets. No, you gotta have a lifestyle change. So my personal favorite, and the one I really believe in, is the Mediterranean diet. And that, we can do a whole talk on that perhaps next month. But this picture on the right kind of shows you where you're going. Blueberries, probably the healthiest thing you can eat next to olive oil, which is in the back there. Blueberry is antioxidant, anti-inflammatory at massive scales. Salmon, which gives you your omega-3s, so that depicting fish-based foods with omega-3s instead of omega-6s. And that's just a type of fatty acid that keeps those cell membranes we talked about healthy. And fruits and vegetables, obviously. So a Mediterranean or South Beach diet, I think, is the way to go if you can do it. And if you want me to give a talk on that, let me know, and I'm going to do that. Complementary Alternative Medicine, CAM. There is a whole National Institutes of Health department on CAM. Believe it or not, look it up. There's tons of government money going into this, not even close to as much money as goes to cancer and heart disease, obviously. But the government is actually funding studies in this. So what we've learned is one of these natural treatments that, you know, a lot of your other doctors will say is for the tree huggers and the hippies. It actually works. There's been a lot of studies done in Germany and Europe, and then the NIH is looking at this too. Alpha lipoic acid, or ALA, to treat diabetic sensory polyneuropathy. So ALA is required for the cells to make energy. And remember, this is a metabolic disorder. It's a sulfur-containing compound, and it's highly antioxidant and anti-inflammatory. Remember, this is a chronic inflammation disease. It has been shown to improve your cell's sensitivity to insulin. Type 2 diabetes is an insulin sensitivity problem. It lowers your blood sugar, lowers your cholesterol, and increases the vessel tone. Remember, I talked about microcirculation problems. So we know that ALA, a natural treatment, is actually an awesome adjunctive treatment for diabetes and diabetic neuropathy. So IV infusions of ALA is the typical way, but you can take oral doses too. It's relatively expensive, I would say, because it's hard to source it well. In other words, to get a good API or you know, the factories that make these substances, you need to make sure it's a high quality place and not a backyard in a foreign country, we'll say. We can offer this treatment to you. We actually do IV infusions of ALA. The recommendations based on the literature are pretty stringent. It's a 3-week program daily, which obviously would just mean 5 days a week. And you come in and get an IV infusion of ALA, but it's had awesome results, and this has been proven in the literature. It's natural, almost no side effects, if any, and it's healthy for every other part of your body too, because of the effects of inflammation and oxidation and reductions in those, and also helping cell membranes, which is massively important for brain health. Of 75,360 infusions studied, there were 0 adverse events. So we think this is a great adjunctive therapy, really for mitochondrial health and anti-aging, but especially for diabetes and diabetic neuropathy. So if you think that you have a relative or you might benefit from this, come talk to us about it and we can set up a program.